Interesting that you say you were able to get free flow, and Rob Byrne, who is also watching the roads for us, says there is free flow, but the footage coming in says tells a completely different story. Put this against what the community is saying, that they're really a traumatized community that has limited movement, and their children cannot get an education because of the drug infestation in the community.
Okay, first of all, I don't live in that community. The hospital is part of the community, so I would drive into the community and serve the community. So it's difficult to experience or speak on behalf of the community.
Absolutely.
But I do sense that there's a real sense of frustration.
And I apologize, we're just taking the benefit of having you here.
No, that's fair enough. I think there's certainly, talking to colleagues who live close to the area and patients, there's a real sense of frustration, of lack of sort of action against drug activity and criminals, and so the community is in a sense under siege from this kind of activity. Only just last week a woman was killed and a child,
absolutely, that's what started it
just
all.
outside the hospital, and so you can understand the community's sense of helplessness and hopelessness in the situation. So I think many of my colleagues in the hospital stand together with the community in trying to address things that just haven't been dealt with for a long time.
You're the head of pediatrics at the facility.
That's right.
The children are dying. What's happening?
Okay, so I just need to correct something that was mentioned right at the outset, that there were 9 babies that died from a bacterial outbreak. That's not correct. There were 9 babies that had died over a period of several months from something we call NEC. NEC has got a long name, necrotizing enterocolitis. Okay.
All right.
Now, whilst NEC can be associated with infections, and infections in babies, particularly premature babies, can occur quite easily and can contribute to this thing called NEC, they didn't die from infections that, as far as we are aware of, or we didn't identify organisms that we could say this bacteria caused the death of this baby. So very different from the Telemokarani situation, because I see that the two
absolutely. We're just making a
the
comparison.
reason we call it an outbreak, NEC outbreak, is that they tend to occur in clusters when they do. Now, I need to just spell out what NEC is. Necrotizing enterocolitis is one of the commonest complications in premature babies.
All right.
It can occur in full-term babies, but it's a particularly common in premature babies.
So if you say it's in premature babies, it means it's not something in the hospital.
Well, there are factors that may be in the hospital. There are factors that could be, like infections that can contribute to it. But prematurity is the biggest risk factor for why these babies get NEC. What alerted or what concerned us was that whilst we would have maybe 1 or 2 cases of NEC per month, and this is the case for many hospitals around the country, it's not unusual for NEC to happen in premature babies. As I said, it's one of the commonest complications.
Does it have to result in death?
It has a very high mortality. It doesn't have to, but it has a high mortality, upwards of 50%. So unfortunately, the babies who do develop advanced NEC may need surgery, and often even that is insufficient. So not all babies die when they get NEC, but a high percentage of them do.
We brought you in because we were alarmed by the numbers, but are you saying it's a common occurrence?
So were we, and I can explain why we were alarmed. We were alarmed because, and why we called it an outbreak, is that instead of having 1 or 2 odd cases in the month, which is too many, but it is the background, it's the baseline rate in many centers, we saw that jump to 4 to 6. And when we saw that jump in March, this is when we alerted the NICD to come and investigate whether the cause was potentially infectious.
Is this national?
Yes, the National Institute of Communicable Diseases, which they did, and alongside with them we worked through it over several weeks.
So something is being done?
Was done. I must say that outbreak has stopped.
Okay.
Right?
Okay. Oh, that's good.
So by the end of July, in fact there was only 1 case reported in August. So by 20th of August, the outbreak was declared by everyone in the team that was working on it as having ended. So as we speak now, we don't have an outbreak of NEC. We may have the 1 or 2 cases. In fact, there were a couple of cases that occurred after August, but it has returned to our baseline rate of NEC.
Do you know that? Do you know if your facility was the only one affected, or if there were problems elsewhere in the country?
I'm only aware of ours at the time.
Yeah. Your Rahima Moosa Mother and Child facility is very highly regarded. It's one of the facilities that government talks about when they want to showcase some of the public service institutions that are working. What makes it so?
You know, I think that I think we're a very busy hospital. We're the only mother and child hospital in the country. We have upwards of 12 to 14,000 deliveries per annum. We're a teaching institution.
I thought you were going to say in a day. I nearly fell over.
We're a teaching institution, so a lot of teaching happens there, both for nursing and for doctors. And so it's an academic center. And I think as a result of that, lots of doctors train there, lots of doctors develop their pediatric training there. And I think we'd like to, in spite of the difficulties we face with large numbers of patients and lack of all the resources we'd like, is of a high standard. So I think, you know, that's what I think makes the place special, and why a lot of us work there.
Are you affected by the social issues taking place around you?
Oh yeah, absolutely. Absolutely. From the fact that we identify with our patients in the communities who are having to undergo such hardships and face this sort of almost sense of siege in their own suburbs and homes. And it affects us. It affects their health. It affects their access to health.
So in closing, we can say that the outbreak has been curbed.
Yes, the outbreak has been curbed. But I'll just say this, that we have to be constantly vigilant, because you know, outbreaks occur all the time. And as healthcare workers and as a community, we have to constantly be vigilant to look at what are the factors that cause it. But I really want to say that we didn't identify a cause. That's not to say there wasn't an infectious agent. It was looked for, blood was looked at, stool was looked at, but nothing was identified as the cause of the agent.
Just a quick one. We're supposed to wrap up our conversation, and I know this might not be your area because you're not speaking for the hospital, you're speaking for your division, but there were reports earlier that the hospital could be moving some patients to other facilities due to the protest action, the community protest action outside. Is that the case? Do you know?
I'm not aware of that.
Thank you so much. Professor Ashraf Kovadia is from the Rahima Moosa Mother and Child Facility and giving us positive news there, saying that an outbreak has been stemmed. Let's take a break.